I'll tell you what, let's go ahead and get started. Thank you everyone for joining us today. I'm Scott Ranges, Director of Graduate Admissions here at the USC College of Nursing. Welcome to this online information session for the USC College of Nursing. Today's session is going to focus specifically on our Doctor of Nursing practice programs. Before we get started, I have a few housekeeping items that will help things run a little bit smoother. It's helpful if, when you ask a question, if you give your name. Also, if you're not speaking, it does help if you mute your microphone. I know we've got a small group today, so maybe saying your name won't necessarily be necessary, but it does help mute your microphone when you're not on. That'll cut down on some of the background noise. This session is also being recorded, and everyone will receive a copy within the next day or so. All right, let's get started. So this is the format of today's meeting. We've got a presentation that will last about 30 minutes to get through. At the conclusion of the presentation, we'll open it up for general questions. Having said that, this presentation is very informal, and you're certainly welcome to ask any questions throughout the presentation. If you do ask a question that's going to be addressed in another slide or so, we may ask you to put that question on hold briefly until we get started. We are very fortunate to have Dr. Kate Jones joining us today. Dr. Jones is the director of the DNP Nurse Executive Leadership Program. And although she specifically focuses in the Nurse Executive Leadership Program, she's going to give an overview of all the DNP programs. So welcome, Dr. Jones.
Thank you. Glad to be here.
Thank you. Okay, I think we've already done the sound check. Everybody can hear me okay, so we can get through that. You have the options of either speaking your questions, or if you'd rather send them in via chat, I can check that as well. So thank you. All right, here's the agenda for today's session. Some of the topics that we are going to address are true across all DNP programs, and some are going to be specific to the USC College of Nursing. Again, just want to say that this presentation is very informal, and you're certainly welcome to ask questions at any point throughout the presentation. Before we get started, does anybody have any specific questions? And we'll make sure that we address that when we get to that portion of the presentation. Okay, not hearing anything. I'll assume that's a no, so let's continue. All right, before getting into the details of the program, we're real proud to announce that earlier this year, the U.S. News and World Reports named us the #1 graduate online nursing program. This is the 7th consecutive year we've been in the top 10. And, again, in addition to the #1 online graduate nursing program, they also said we're the #1 online program for veterans. And they specifically also identified our nurse practitioner program and our nursing administration and leadership program for being some of the top programs in the country. All right, at this point, Dr. Jones is going to take over and cover the details of our DNP program.
All right, thank you. I appreciate it. So one of the questions, if you're considering going back to school for a terminal degree in nursing, is the option between a DNP and a PhD. And so the DNP degree is a practice-focused degree. It's about application of evidence for best practice and process improvement in healthcare settings. DNPs are clinical practitioners, executive leaders, and scholars in clinical and leadership roles. The PhD, on the other hand, is a research-focused terminal degree in nursing, which focuses on creating new knowledge as a nurse scientist. Our PhD colleagues have research careers, typically, in academia and clinical, government, and health system settings.
Thank you.
So if you were to ask the question, who should get a DNP? Of course, I would say everyone should know. So nurses who want to advance their career and assume clinical expert and/or leadership roles in practice settings should consider the DNP. Again, it's a practice-focused doctoral degree. So your love of nursing practice and your love of caring for patients and or supervising leading the care of patients should be something that you're very interested in and interested in pursuing in your doctoral program. Someone who's interested in evaluating and improving health outcomes using evidence-based practice should consider a DNP. And those who are interested in quality improvement and systems leadership. Leaders in healthcare organizations should consider getting a DNP. A CEO, a CNO, directors of quality, patient experience, nursing practice, consultants, and then health policy professionals and nurses who want to pursue a career in academia, but don't necessarily want to go the research route and getting a PhD, may find a home in academia with a DNP degree. So what's included in the DNP program? There are both clinical and didactic experiences. The didactic experiences focus on leadership development, health policy, evidence-based practice. And then for a majority of the time in your DNP program, you'll be working towards developing and implementing and analyzing the results of a DNP project that applies evidence to a quality improvement, EBP application, or a health policy issue in a clinical setting. You may hear that called a number of different things, the scholarly project. Some schools still use the term capstone project. That's really not a recommended term anymore. We call it the DNP project. And as I mentioned, you'll take didactic courses, clinical courses, and some programs also have immersion courses. We'll talk about that in a minute. To earn a DNP degree, you have to have 1,000 clinical hours total. So for someone who's coming into the DN program prepared as a with a Bachelor of Science in Nursing, you'll have to complete all 1,000 hours during the program. If you come to a DNP program with a master's degree in nursing, we will look at how many clinical hours you completed in your master's degree, and then we'll do a gap analysis to see how many you need to complete in your DNP program to reach 1,000 hours. So there are many options, and we're lucky here to have skilled faculty in all of these areas. So you have many options for DNP degree progression at the University of South Carolina. For BSN entry, so students entering the DNP program who are prepared with their baccalaureate degree, you can select the Adult Gerontology Acute Care Nurse Practitioner program, the Family Nurse Practitioner program, the Psychiatric Mental Health Nurse Practitioner program, or the Nurse Executive Leadership program. And as you can see, if you can see the screen, these programs from BSN to DNP do require quite a commitment on your part. The nurse practitioner programs on a full-time basis are 9 semesters in length. On a part-time basis would be 12 semesters in length and have 24 or 25 courses to complete. The Nurse Executive Leadership program, if you enter with a BSN, takes 8 semesters full-time or 11 semesters part-time and includes 20 courses. BSN entry, we only do in the summer. MSN entry, which we're going to talk about next, we do in the fall. So the options for entering the DNP program with MSN preparation. So if you're someone who already has a nurse practitioner, completed a nurse practitioner program and has a master's degree in nursing, you would be in what we call our no concentration postmaster's advanced practice nurse practitioner program, because you've already concentrated on your clinical specialty. In this case, you would be returning to school to advance your education to the doctoral level. And so that program is 11 classes over 6 semesters. The nurse executive leadership track for those entering with a master's degree is 12 or 13 classes, depending on whether you had finance in your MSN program, and that's over 7 semesters. And as I mentioned, we start our MSN entry cohorts in the fall.
Thank you. Shantae, I know that you are a no concentration person and you've actually already submitted your application. Adam, which option would you be? I believe you're MSN entry, but would you be nurse executive leadership or the no concentration track?
No concentration
No
track.
concentration. Okay, good, good. Thank you. All right.
Okay, so as I've said a few times, the course format is didactic with online courses. And then for some programs, there are immersions for on-campus checkoffs of clinical skills. And then, and Scott may have to answer questions about which programs specifically include those, because the nurse exec program does not. And then there are clinicals within healthcare facilities. So in a practice setting, you would be completing either direct or indirect clinical hours, depending on your program track.
And as far as the immersions go, that's only for the BSN entry clinical courses or clinical concentration. So those folks interested in either acute care, FNP, or psych mental health concentrations.
So I thought that's what it was, but I didn't want to say because I wasn't positive. So thank you for confirming. So we really then don't need this particular slide, since both of you who are on the call are interested in the master's entry with and the no concentration track. As far as those clinical hours that we talked about, the requirements are discussed after admission, but basically students seek out their own clinical placements to meet specific learning needs. In the postmaster's courses, many of those hours are related to your DNP project. So you're in the early part of the program thinking about your project, thinking about where you want to do your project, who might be a preceptor for you at a particular clinical site. And then once all that's in place, you know, you've done that thinking, then of course we have to be sure that all the administrative requirements are met. So there has to be a contract with the clinical site, and then the clinical site and the preceptor both need to be approved by the program director. The travel requirement, in my understanding, is more related to our BSN to DNP entry students who are needing to get that initial nurse practitioner clinical experience, and may need, because as I'm sure you both already know, finding those placements is sometimes a bit of a challenge, and they may have to travel for that too, for that. But in the MSN to DNP courses, our program, that is not as much of an issue.
All right, I'm going to go ahead and take over now. As we've mentioned so far, we'll accept it, applicants who either have a bachelor's or a master's degree into the program. So for what's required, we're going to need copies of all transcripts. So if you have multiple degrees or attended multiple schools, we'll determine what we call a cumulative GPA. And that includes transcripts from anywhere that you ever got college credit. Sometimes you've got folks who did courses during high school for college credit, or maybe you took a summer course someplace else to get a lab out of the way. We'll need copies of those those transcripts. And we prefer applicants who have a 3.0 GPA or higher. I will say that some of our programs are a little bit more competitive, and some of the GPAs of admitted students tend to be a little bit higher. You must also have a current unencumbered license. in the state where the clinical requirements will be satisfied. Again, this is probably more for the clinical portions, or those people doing the clinical degree. It's important to note here that some of the state boards of nursing have recently imposed additional restrictions for delivery of online content of courses to students from programs outside of their state. So currently, not every state is allowed to be enrolled in our program. We do have a list of all the approved states on our website. And if you're not sure if your state is approved or not, you can follow up with me later, and I'll be glad to share that with you. I will say that we do review this regularly and add any states as we can. We've recently added Indiana, Maryland, and Hawaii. And then finally, everyone who satisfies all the requirements above and looks like a viable candidate is invited for an interview. And typically the interviews are done either via Zoom or Teams. So what's the application process? Interested applicants submitted an online application to the graduate school. The application includes a copy of your goal statement and a current copy of your CV or resume, as well as your nursing license. You should include a personal statement that describes the advanced practice role and scope for which you're applying. Be sure to indicate how the program will advance your professional goals. If there are any unique circumstances in your academic or career background, this would be an appropriate place to include that information. We do ask that you keep this brief, though. You're encouraged to keep your personal statement to no more than 2 pages if possible. I know that none of you are applying to the clinical tracks, but if anyone was applying to the clinical track, acute care, FNP, or psych mental health, they would also need to submit their BLS certifications. Anybody specifically interested in acute care must also include ACLS certification. You need to include 3 recommendations from individuals who are doctorally prepared in the healthcare field. When you complete your application, you'll list the names and the contact information for those individuals, and they will receive an electronic recommendation form that they can complete and submit online. As previously mentioned, we need copies of all transcripts from anywhere that you went to school. We can use unofficial copies of the transcripts for the application review process. If you're admitted, we'll request official copies at that point. We'll also need what's called a verification of work hours form. And this simply confirms that you've had at least 2,400 hours work experience as a nurse within the last 24 months. This is roughly 1 year's worth of full-time work experience. You can access the form on our application, and this is something you'd give to either your HR department or your supervisor, and they would just sign it and then give it back to you, and you could upload it with your application. Finally, as you can see here, we do not require a GRE or any other standardized test for the DNP program. Most of these items can be uploaded with your application, and some of them are actually required. You won't be able to submit your application until you get them uploaded. After you submit your application, you can log back in to see what additional items have arrived. Sometimes things like transcripts are being sent from other sources or recommendations. Once you're done and get it submitted, we will let you know what it has arrived. All right, what are the application deadlines? As mentioned earlier, the BSN entry program starts during the summer. Their applications open July 1st. There's a October 31st priority deadline and a February 1st final deadline. For the MSN entry program, which is what both of you would fall under, that's a fall start. Applications opened November 1st. Priority deadline is March 1st. Final deadline is May 1st. As previously mentioned, do encourage you to, regardless of which of the deadlines you're looking at, encourage you to submit all your applications prior to the deadline so that all the items can be processed in a timely manner, and then you still have time to submit any outstanding items that may not come in, whether your transcripts or recommendations. Those are the 2 things that typically tend to take the longest. I will say that there are some benefits to applying for the priority deadline. Potentially, you could be nominated for some college or university scholarships that you may not be eligible for if you wait and apply at the final deadline. Also, the earlier you apply, the more time you have to get any outstanding items in. So don't wait till the last minute. That's when everybody's going to apply, and it'll take longer for everything to get processed by the graduate school. All right, where do you send everything? As mentioned earlier, you're encouraged to upload as much as you can with your application. Any official items that you're having sent, for example, transcripts, they can either be sent to the email address listed here or mailed to the address listed here. After you submit your application, you cannot add anything to that. So if you have something that you want to add later on, you would just send it to that email address there and we'll make sure it gets added to your application. We will also review your application once it's submitted, let you know if you have any outstanding items. And then once your application is complete, we will let you know when it gets sent to the department for review. All right, we do have some scholarships specifically designed for DNP students. First thing is you need to be admitted to the DNP program to be considered. The requirements are a 3.0 GPA if you're entering with a BSN, or a 3.5 GPA if you're entering with your MSN. The expectations are that you'll be enrolled full-time, and both BSN and MSN entry students are eligible. There is an additional application that's required, and the scholarship process is competitive. We'll share details with everyone who is eligible. You can see the application deadlines there. Oop, I've actually got the wrong date. So for the BSN entry students, the application deadline is March 15th. June 1st is the application deadline for MSN entry students. And the deadlines coincide with the application deadlines mentioned earlier. And again, more details will be sent to applicants once they apply and get admitted to the program. Again, if you wait to the last minute to apply, you may not be eligible. So I do encourage you to get your application submitted prior to the deadlines so that you can take advantage of everything available for you. We included some important links here. The first one is to our DNP website, which has basic information about the program. The second link there is to our scholarship information page. And the final link is to the graduate school application itself. Okay, we've covered a whole lot of information in a short amount of time. What kind of questions do you guys have?
Thank you so much for all the information. It was very helpful. Just a question regarding, I guess, tuition, I guess, out of state versus in state, with it being a graduate program. Is it a flat fee by it being a doctoral program for a graduate rate, or, you know, just wanted to know what that would look like.
Right. Great question, Adam. So it is a differentiated rate because it includes both clinicals and potentially some immersion courses. So in-state tuition is $770.25 per credit hour. Out-of-state tuition is currently $1438 per credit hour. So what you would do is on one of the previous slides, it had a list of the number of credits required for that specific concentration, and you'd simply multiply the per credit hour rate times the number of credits. One of the nice things about the scholarships is that for out-of-state students, we can give them enough scholarship money, not that reduces their tuition to a certain rate, but we can give them, once they reach a certain threshold, the university will automatically reduce their tuition to what they call near in-state tuition. So once you get enough scholarship money, the rest of your tuition gets reduced a good bit. Again, we can't offer those, unfortunately, to everybody as much as we'd like to, but we do try to award that to as many people who as possible. I will say that there are some other fees related to the program besides tuition. If you look on our website, there's a complete list of all program fees that you can anticipate. And also we share all information about either university scholarships, college scholarships, or outside funding sources that we know that you'd be eligible for. So great question.
Thank you.
All right, what other questions people have?
The only question I had, hope you can hear me okay. Just out of curiosity, I know y'all briefly covered it. And since we're on the, what we call it, the no concentration, kind of clarify again, and it may be clarified after we get accepted, but as far as like the hours needed, I guess my question is, like, for instance, when I start working on the project or whatever, I mean, are we going to get enough time ahead of time, I'm assuming, to be already looking? Because like you say, as of now, you know, it's like really, really competitive. There's a lot of nurse practitioner schools and programs, and everybody's kind of, you know, fighting for, you know, location and everything like that. So how soon will we have an idea if we get accepted into the program of like, hey, this is what your project and your expectation is on? Like, hey, this is where, I guess I just want to have enough time to kind of, you know, find that location.
Sure, sure. Dr. Jones, you want to address that? I think you're on mute right now.
You know, you would think that after a year, unmuting myself would be quicker, but I apologize. So yes, I can answer that question for you. So in the postmaster's DNP, no concentration program, your clinical courses, you take a health policy course that has 40 hours, but you don't have to find a site for that. That's explained in the beginning of the course, and you list your faculty and the University of South Carolina as your clinical site. So people get a little confused about that one because it's done a little bit differently. So that occurs in the second semester of that program, but that one you don't have to worry about finding a site. Your project planning course, Nursing 783 in that program, is the first semester of your second year. So fall, I believe, of so somebody who started this year, it would be the following fall. And that's when you're thinking about what your project, by that point, you've figured out what your project is going to be about. You've talked to people at your clinical site and asked who is, and most people do it where they work, not all, but most students do this project where they work because they have access to, you know, you've identified a clinical problem in the setting that needs to be addressed. You have access to stakeholders, you have access to data, and access to what you need to do a project. So typically, if you do it where you work, you've had time during the first year to talk to whoever it is you've identified would be your preceptor, and made sure that there's a contract in place, gotten the site approved, and then you proceed with your project planning course in that first semester of your second year. And then you do your project implementation the next semester, and then you do the project analysis your final semester before you graduate.
Okay, perfect. That was my next question about, you know, because the company that I work for, we're very large, and that was going to be my next question if for some reason. So you answered that question. That's great. One more question, guys. I'm sorry, Ms. Smith, you may have been up next. I also want to ask, how much campus hours will we ever need to come on campus? Just out of curiosity.
Yeah, in that program, the only requirements are for your proposal defense and your final defense. We may at some point add a pre-program immersion orientation type on-campus visit, but we have not done that yet for that program. Also, the defenses, the proposal defense and the final defense, of course, during COVID have been all done remotely. So it actually is nice to do them in person, gives you an opportunity to interact with your committee members and some other faculty, but they have been remote for the last year. So fingers crossed, by the time anyone who starts this fall next fall would get to do their defenses, we would be able to be back in person.
Thank you.
And can you all see the schedule that I put up there?
Yes.
Okay, I just wanted to make sure that you saw that. Okay, good. What other questions you folks have?
I'm sorry. Can you go back to it? I'm sorry.
Oh, sure. There you go. As you can see, it's 2 courses per semester.
And this is the full-time model or?
Okay. It is, I do see that it says fall starts, but it does show a summer 1. But let me check on this. And then what I can do is when I send you guys a copy of the recording, I'll make sure that I've got an updated copy of the schedule there as well.
Okay.
Yeah, but that's kind of an outline. You plan on doing, 2 courses per semester throughout the program. What other questions? Can't believe we've answered everything.
I know I called myself writing down the questions that I had, but I forgot I had to run errands today. So I left my little, it wasn't that many. The main 2 was the one that I asked. I can't think of, it was one other one, but I can't think of it. So that's
Well,
all I have.
You'll think of it right after we hang up.
Right.
So, but related to that, here is our contact information. So if you do think of any questions later, feel free to follow up with either Dr. Jones or myself. But we're certainly willing to stay on as long as you guys have questions. But if you're past the point of asking questions right now, no need to stay if you don't.
Right.
Well, thank you so much. All this information was very helpful.
Good.
Yes.
Good. All right.
Yeah.
Well, like I said, I know Shantae's already submitted her application. Adam, are you going to submit yours?
Yeah. So as you said, the program I would be seeking is the postmaster's entry, I guess, for those who are already nurse practitioners. But potentially looking, I guess next start would be fall 2021 then, correct?
Right.
Okay.
And again,
Yes.
the priority deadline is March 1st.
Right.
If you can't get everything in by then, that's fine. We'll continue taking applications till May 1st, but don't wait till May 1st. Go ahead and submit everything once you get it ready.
Certainly. Okay.
Let me ask you both, what is your nurse practitioner specialty?
Mine is family practice. I do like nurse practitioner home visits and like the home. I also see hospice patients, palliative care patients, but it's in a home-based setting. Mm-hmm.
Well, that's right up my alley. I did home health care and hospice nursing for a long time before I came into academia. So,
Oh, okay.
yeah. And how about you?
Yes. So I'm a family nurse practitioner as well, and I practice endocrine, so endocrine specialty practice, private endocrine practice, and we also do hospital. We cover the inpatient endocrine specialty service.
Great. Well, the postmaster's program is very manageable for working nurse practitioners, and you get to work on solving a clinical problem in your work setting. So it ends up being a win-win for both you and your organization.
Awesome.
All right. Well, do either of you have any other questions? Now's your time while you've got us.
Nothing I can think of, but like you say, as soon as the call ends, my mind will start rolling.
All right.
Yeah.
Okay. Well, Dr. Jones, do you have any final thoughts you'd like to share?
I don't. I appreciate both of you joining us today. I hope that you're excited about the possibility of pursuing your DNP here at the College of Nursing.
Oh, yeah.
Thank you so much.
All right. Well, thank you both for participating. And if you have any further questions, don't hesitate to reach back out. And again, I'll be sending a copy of the video hopefully by the end of the day.
Okay, great.
All right.
Thank you all so much.
Have a good afternoon.
You all too. Bye.
Bye.
Bye.